Welcome to this episode of the Clinical Podcast Series brought to you by the American Academy of Optometry Foundation. On today's episode, we'll be discussing the article entitled Correlation of Adenoviral Titers with Severity and Adenoviral Conjunctivitis and Time to Viral Clearance for 21 Days, published in the Academy's journal, Optometry and Vision Science in 2023. I'm Dr. Kelsy Steele, your host and topical editor of the Anterior Segment Disease Care section. I'm thrilled to be joined today by our topical expert for this podcast, Dr. Jennifer Harthan. Dr. Harthan is a professor and chief of the Cornea and Contact Lens Center for Clinical Excellence at the Illinois College of Optometry. Dr. Harthan is a fellow in our academy and also a diplomate in the Cornea Contact Lenses and Refractive Technology section. And as an added bonus today, Dr. Harthan is one of the authors of the study that we're discussing, so we look forward to getting the inside scoop from her. Welcome, Dr. Harthan. Thanks for coming.
Thanks for having me. I appreciate it.
Yeah. So to start off, what was the general purpose of this study? I know this is not the only publication from this study, but what was kind of the overarching question that you guys had?
Yeah, so I think just to kind of give some background about the RAPID study. So the RAPID study was a pilot study that looked at the efficacy of a single in-office administration of 5% povidone iodine. And what we wanted to do was compare that with artificial tears for those patients who presented with adenoviral conjunctivitis. So what we looked at is we looked at patients who presented with signs and symptoms, and then we measured their viral titers with qPCR. We looked at their patient-reported symptoms and clinician-graded signs, and we not only did that at their baseline visit, but then we did that over the course of 21 days of follow-ups. So that was sort of like the overall goal of the pilot study, and that was like some of the previous reports that we have published. But then when we look at this specific publication, this looked at the correlation of viral titers in patients with qPCR confirmed adenoviral conjunctivitis. And what we looked at was the correlation of those viral titers with severity of symptoms and clinical signs over time, as well as complications.
Great. And when were you typically seeing these people? They were included in the study if they were confirmed with qPCR, correct? That was an inclusion criteria?
Yes.
Okay.
Yeah. So,
Go ahead.
No, so just to be included with the study was, the presence of a red eye, but then in order to be randomized, eventually they had to have qPCR confirmed.
Okay. And then if they enrolled in the study, how frequently were you seeing them typically to check on these signs and reported outcomes from the patients?
Yeah, that's a great question. We actually saw these patients quite often. We saw them at a baseline visit, and then they had a 1-day follow-up, a 2-day follow-up, a 4-day follow-up, a 7-day follow-up, a 14-day follow-up, and a 21-day follow-up. So we were seeing these patients regularly in the clinic, but I think, there's several reasons why we wanted to do that. We wanted to see what was happening with those viral titers, and we also wanted to see what was happening with their signs and symptoms, so that, we could have some trends to look at.
Yeah. So was anything surprising that you guys found throughout the course of this?
Yeah. So, I think overall, so going back to sort of like the initial reports that we published. So what we wanted to look at again was just like the safety and efficacy of povidone iodine. So what previous reports have shown that it's safe, it's efficacious, it can reduce viral load and hasten symptoms. In this specific report, what we found is that there was really no difference between viral titers in either randomized group. So those patients who had received the povidone iodine or in those patients who had received artificial tears, except for at visit 4, which is really interesting. So I think that was interesting. We found that those subjects who presented with higher baseline viral titers, correlated with more severe signs and symptoms across the 21 days of follow-up. So that wasn't as surprising.
Yeah.
But some of the things that were surprising were maybe the persistence of some of the signs and symptoms that clinicians we use as maybe releasing a patient to go back to school or back to work. So I thought that was more surprising.
Yeah. So based on what you guys found, our viewership, our listenership as eye care professionals, are there any implementations, any changes that we should make based off the findings, based on these recommendations?
Yeah, so I think what would be fabulous, and I think those of us who participated in this study, I think it really sort of highlights the need for a real-time PCR test. I think that would be fabulous. That could help us aid in both the diagnosis, but also looking at viral clearance. I think that would be so helpful. But also when we look at specifically this report, some of the traditional signs and symptoms that we've utilized for patients with adenoviral conjunctivitis, conjunctival follicles, redness, those still persisted even after viral titers were no longer detectable. However, participants who didn't have viral titers detectable, they didn't have serous discharge. So maybe we should be looking more at discharge versus the conjunctival follicles and redness as determining when we should release a patient back to work or school. So I thought that that was probably one of the more interesting aspects of this particular report.
Yeah, I agree. I mean, we think of viral conjunctivitis as having all of these different features,
Right,
but some of them
right.
may be more indicative of
Right.
viral clearance than others. So I think that's a great takeaway.
Yeah.
Well, thank you so
And
much.
obviously I was just gonna say, obviously there's always more work that's
For
can be
sure.
done and there's limitations, but I think this is a good starting point and, just gives us more food for thought.
Yeah, wonderful. Well, thanks so much for your insights today, Dr. Harthan. Thank you all for listening or watching. We'll see you next time.